January 12th is National Pharmacist Day, and joining us today to tell us about Omni Family Health's pharmacy program is Dr. James Deal with Omni Family Health. Hello, sir.
Welcome.
Great to have you on the show today.
Yes, thank you for having me.
Okay, so pharmacists play such a key role in patient care, and I feel like you don't really get a shine in the spotlight here a lot. You're kind of a behind-the-scenes player a lot of the times.
Yeah, that's probably the way it's perceived, but for the most part, we're the last line of defense against most medication errors and medications in general. People don't play a significant role in determining this. When you go to your doctor's office, you know, he's going to give you what he thinks you need.
Right.
And at that point, it comes back to us in the form of a prescription, and we're able to evaluate it, run it through our programming, determine whether or not there's drug interactions or other opportunities to make your health better.
So can you share what makes Omni Pharmacies unique? I know you have like free prescription delivery benefit for your patients, but what other things are you offering?
Well, that free delivery, let me tell you, that's a game changer.
That is a big one.
And that's probably 60 to 70% of our output right now.
Oh, wow.
But we also have a direct relationship with our physicians. And that relationship, including access to the physician database, allows us to look at notes and understand what's going on. For instance, if you get diagnosed with diabetes and the doctor's going through his load for the day and he forgets to give you a statin, which is for cholesterol, it's important for diabetics to have that.
Wow.
The pharmacist has a relationship that we can write that prescription without having to send you back.
What a unique complex where you're able to actually talk to the patient's doctor if need be and even look into their notes. I mean, that's not really common.
Not at all, not at all. And in a health-based system, it's closer related to a hospital system, but it's external.
Yeah.
And so we're managing that along with our other opportunities and growth-related projects to get closer to these patients, especially in indigent and rural areas.
Yeah, I mean, medication is a big part of quality care. So let's talk about the federal 340B program benefit with Omni.
So federal 340B allows pharmacies and physicians to get discounted medications and pricing. One of the key things with that system is called the sliding scale. So if you don't have health insurance and you need it, you can come to Omni Family Health and we do what's called a sliding scale based on your income. So your income will determine what your co-payment is, how much you're going to pay for medications, and it's very cost efficient. Not many other people after the first year will have this ability unless they're 340B in the rural area. 340B is mostly used in the hospitals.
And that's so important to people because, I mean, everyone's financial situation is kind of crazy right now. Things are very expensive, especially when it comes to healthcare and medications. And, you know, God forbid somebody not treat their medical condition because they can't afford their medications.
Yeah, I see that a lot. I see people turn it down because they don't have the cash. But we have a discount program for that if it doesn't work. And I have the ability as a pharmacy manager to look at the overall profile and to determine if this patient needs it.
So I know there are plans for, you know, Omni Pharmacies to expand. So let's touch on that just a little bit.
Well, right now we have 11 pharmacies in total. We cover Kings, Kern County, Kings, Tulare, and Fresno.
That's a pretty good chunk of land.
Right, and we just opened the second pharmacy in Fresno, bringing us up to 11 pharmacies.
Wow.
Now we have 3 in Bakersfield on the east side and 3 on the north side, or on the west side, so we cover Bakersfield pretty well, and all the outlying areas for free delivery. Wow. So we've put a stamp in there, we've made sure we have good coverage. There's always additional opportunities to grow forward, and we're constantly looking at that. And just to touch base on 340B, that cost savings right there goes into our growth.
I love that.
And allows us to continue to expand faster.
Well, I am just over the moon right now, like with joy and happiness. So we're going to put Omni's information on the screen right now. So reach out if you are looking for pharmacy care or a team of doctors who are all interlinked who can help you out. Thank you so much, Dr. Deal. It's great having you today.
Thank you so much. I appreciate it.
With that, we're going to take a short break. We'll be right back.